Hi, I'm Dr. Jen Peña, and I'm here to give you the scoop on all the headlines in sexual and reproductive health that are dominating your group chat. This is Doom Scroll.
Hi, how are you doing?
Hi, Annie. It's great to see you.
So great to see you. I'm so excited for what we're talking about today. You need to tell me a little bit more about emergency contraception vending machines. So I'm just curious a little bit what you know and why is there so much controversy around it? For people who don't know, how is emergency contraception different from the abortion pill?
Emergency contraception, also known as the morning after pill, right, is used to prevent pregnancy after an unprotected sexual encounter. So things like, there's a broken condom or somebody missed a birth control pill, etc. Again, just to remind folks, emergency contraception can be used up to 5 days after the unprotected sexual encounter, but it is most effective within the first 72 hours. The way it works is it delays or stops ovulation. So it delays or stops the egg from being released, and that's how it can't get fertilized by the sperm. In EC, emergency contraception does not induce abortion or terminate an existing pregnancy. That's the most important thing to remember. So the abortion pill, differently, is typically used within those first 10 weeks of pregnancy. So pregnancy has already occurred. The way it works is it's two different types of medication. One that blocks the hormone progesterone, which is needed to maintain a pregnancy, and the other one helps contract the uterus and expel the pregnancy. Very different from emergency contraception.
Why do you think that vending machines have been chosen as the method of distribution for emergency contraception, and how are they becoming more available, and where is this happening?
The vending machines have a lot of benefits because, again, it's accessible and you can make it accessible, 24/7 versus something like a pharmacy where they're not always open all the time. And, this is important because unprotected sex can happen at any time. I think it also, helps with privacy and discretion. It's still a little scary for students sometimes to even go get emergency contraception at the pharmacy, even if it's over the counter, because you have to check out with it. And so this reduces that stigma that's associated with getting emergency contraception. From a public health perspective, it's helping lower the incidence of unintended pregnancies. It's all great for student health.
Why do you think that there's pushback against emergency contraception vending machines?
There are people that just because of their moral or religious beliefs believe that emergency contraception or any form of contraception goes against their values or religious teachings, and we have to be respectful of that. Some people have misconceptions and stigma. Sadly, a lot of those misconceptions come about because a lack of education about what emergency contraception and abortion pills are. Some critics also think that they fear that it might be misused. And honestly, as a healthcare professional, I share that one a little bit because what you don't want is people to rely on emergency contraception as a form of birth control. But what I say to that is it is an opportunity for the companies that are putting these vending machines up to educate.
Can taking the morning after pill cause women any harm or increase fertility risks?
So in terms of causing infertility, this has been researched extensively, and emergency contraception has not shown any evidence that it causes infertility. So that is not something, that should be a concern, in terms of fearing that you won't be able to get pregnant.
Thank you so much. I'm glad that we had this conversation. You could clear the air about common misconceptions around emergency contraception. So nice to talk to you again, and I'll see you soon.